Contributor. With a welcome to you, Doctor. What do you make of the surge we're seeing in several states across the South and West?
I mean, good afternoon, Alex. I'm almost speechless. That's that White House briefing that we had on Friday, the first one we had in 2 months. So 2 months have passed since the last briefing. What do you think has been happening in the country? It's just an explosion of cases all over the country. We in the public health community know what needs to be done to mitigate the risk, to decrease the spread of this virus. It has not been happening really in many of the states where we see a rise. In New York State, on the other hand, as you know very well, we went through a hellish period, and the local leadership at local mayors and at the state level, Governor Cuomo, made the very tough decision, but evidence-based decision based on recommendations of his health advisors to shut down, to really just stringent social control, because that's the only thing ultimately that will decrease the spread of this virus.
Here's what's interesting to me, and to your point, in New York, we saw what's now happening in Florida, Texas, Arizona. Those states and others essentially had a 3-month head start to pay attention, take notes. Is there anything different about those 3 states? Is there a health-based reason that they could approach health safety differently or not?
The short answer is there's no difference, right? I mean, Governor Cuomo has said this, Dr. Fauci has said this, almost every single medical public health expert that you have spoken with has said the same thing. This is a virus, a very infectious pathogen that just doesn't give a damn about your political affiliation, the color of your hair, your religious affiliation.
A state border,
a state border, it doesn't matter. It doesn't care. It's going to be upon us, Alex, to really control and dictate how it's going to work. And look, New York State is a perfect example. After making this tough decision of closing down all businesses, all restaurants in New York State, now look, we have five deaths, which is still 5 too many if you ask me. But remember, at peak, Alex, we had 799 deaths in 24 hours.
Yeah.
So New York State's looking really good right now. But even Governor Cuomo said, we can't afford to become lax. We do not want to become victims of our own success.
Here's something that's of concern to so many. Younger people starting to account for a large number of these cases, and some are worrying that it indicates asymptomatic spread. Do you agree with that? And how concerned should we be about younger people?
Yeah, so we should be concerned, by the way. Again, going back to that briefing when Vice President Pence almost put up an inexplicable positive political spin that the good news, I think he said the good news is that the rise in cases among young people. That is not good news. There should be, if there's a rise in cases in any segment of a population, that's not good news. Because remember, most of these young people, while they, statistically, data show that they will not mostly get severely ill and hospitalized, they're going to infect other people who did not go out, like older people, like say people like my dad, who have a quadruple bypass, you know?
But can I ask you about the message from the White House, which has largely been that we're seeing an increase in cases because we're doing more testing? Fact check that for us. Is that really the reason?
Unequivocally untrue to say that, and again, the vice president almost near the end of that briefing repeated, it just contradicted flat out what Dr. Fauci and what Dr. Birx had shown by the graph about test positivity rate. Let's be really clear. I want to make sure your viewers understand that the rise in cases nationwide is not a reflection of increased testing. The tests aren't causing cases, Alex. The tests are simply detecting what's already out there.
Good point. Dr. Lipi Roy, all of it, in fact. Thank you so much. Let's go from there now to some breaking